Grant Robertson.
Mr Speaker, my question is to the Minister of Health. Are district health boards being funded sufficiently to maintain the level of services they provided in 2010-11?
The Honourable Tony Ryall.
Mr Speaker, DHBs are being funded with the expectation of providing more overall services, particularly in areas of patient priorities like more surgery, faster cancer treatment, more children immunised and faster emergency departments. DHBs make decisions within their increased budgets, and as the member is well aware, the government has always said that we expect that some programs will be slowed, scaled or stopped, and all money saved in health stays in health.
Grant Robertson.
Mr Speaker, was the increase in funding in dollar terms for district health boards in the 2011-12 budget sufficient to meet the cost of inflation and population growth faced by district health boards?
The Honourable Tony Ryall.
Mr Speaker, as I've told the member previously, we can't actually give a firm answer to that presently because additional funds will flow to district health boards during the financial year.
Grant Robertson.
Is Stuart Bramhill, recently retired senior psychiatrist at Taranaki Hospital, correct when she told the Taranaki Daily News that before her retirement, lack of funding meant her patients, quote, couldn't be properly cared for?
The Honourable Tony Ryall.
Mr Speaker, that's not the information that I have. What I do know is that the Taranaki District Health Board has had an increase of $29 million over the last 3 years, and I think the feedback that I'm getting from Taranaki is that the services have really improved there.
Supplementary question.
Hilary Calvert.
Supplementary to the Minister of Health. Given that much of the increased health spending between 2001 and 2006 was eroded by productivity losses of 15% for doctors and 11% for nurses, does he agree that simply throwing money at hospitals is not the answer? If so, what concrete evidence can he provide for improved hospital productivity since he became Minister?
The Honourable Tony Ryall.
Mr Speaker, if throwing more money at the health service was the answer, then actually under the Labour government, where they doubled the health budget in 9 years and got fewer operations, we know that that's not the case. We have put an additional $1.5 billion of new money into health over the last 3 years, but I think when you look at the record numbers of elective surgery, the much faster cancer radiation treatment, faster emergency departments, better preventive health, I think we are getting that productivity that New Zealanders have been seeking, and frankly we could have not achieved this without improved productivity.
Grant Robertson.
Supplementary question. Is Stuart Bramhill, recently retired senior psychiatrist at Taranaki Hospital, lying when she told the Taranaki Daily News that before her retirement, lack of funding meant patients were, quote, couldn't properly be cared for?
The Honourable Tony Ryall.
Mr Speaker, that really is a silly question. Of course, I'm sure Dr Bramhill believes what she told the paper. What I can say is that we've put additional $29 million into the Taranaki District Health Board, and during that time we've seen quite a significant improvement in the number of staff working there. For example, we've got many more nurses than we had at that hospital 2.5 years ago.
Point of order, Grant Robertson.
Speaker,
point of order has been called. Grant Robertson.
Speaker, I appreciate it wasn't a question that the Minister liked, but it was a direct question asking if the clinician mentioned was lying.
No. The member knows that can't expect the Minister to say yes or no to such a question whether someone's lying or not. The Minister explained why he believes that why he disagrees with that clinician, and the Minister's perfectly at liberty to explain why he disagrees with the clinician. Grant Robertson, further supplementary.
Is it acceptable for nursing staff at Taranaki Hospital to regularly double shift and not have a complete 9-hour break between shifts, as was reported in the Taranaki Daily News story on Monday?
The Honourable Tony Ryall.
Mr Speaker, the Taranaki District Health Board has had increased funding of $29 million over the last 3 years, and they have more nurses working there than 2.5 years ago. How the District Health Board manages their services and the way that staff move around the hospital to meet those demands is the responsibility of the District Health Board. What I can assure the member is this government has given the District Health Board quite a lot of extra money.
Question number 7, Kevin Haig. Order, I've called Kevin.